How long can someone live with heart failure? When the news broke that the R&B singer Ray J was hospitalized and he later shared that his heart was functioning at only 25%, I did a short video on it and my comments lit up. Everyone, including some of my patients, started asking me two things. What exactly does that mean? And very importantly, how long can someone live with heart failure? Those two questions can stop people in their tracks. I've seen it, I'm telling you. People will come into my office terrified just because they've Googled one little phrase. They think that all of a sudden their life has an expiration date. I'm Dr. Frida. I'm an MD who has been quadruple board certified. I am a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. I am also board certified in internal medicine and obesity medicine. And after I completed my dual residency in Med Peds at Georgetown University Hospital School of Medicine, I received my board certification in pediatrics. Today, I'm giving you a medical doctor's honest, straightforward answer. I'm going to break down what exactly these numbers mean, what you can learn from celebrities who have faced this, and most importantly, I'm going to break down what you can start doing today in order to live your longest, happiest, healthiest life. First, let's just clear one thing up. The term heart failure is a horrible name, okay? When you hear heart failure, it implies that someone's heart has completely stopped, that it's failed, it's over, okay, it's the end of the road. But that's not necessarily the case. Heart failure simply means that your heart is not working efficiently. It's not pumping blood out to your body the way that it should in order to properly supply your organs with the oxygenation and the blood supply that they need. The heart is still working. It has not completely failed, but that term is a bit overwhelming and scary. And there are different levels to it, of course. Think of heart failure as an engine that perhaps is not working as well as it should because it doesn't have enough power. So the engine still works. I mean, it can still make the car run. The car might not be able to get up the hills the way that it used to with this engine because it's just not working as efficiently as it should. There are different types of heart failure. There is systolic heart failure, which is a condition where the heart is not contracting as efficiently as it should. And there's also diastolic heart failure. And this is when the heart is not relaxing properly. Either way, the main point is that heart failure is a condition that we can manage. It is not necessarily a stop sign. So what about that 25% number we heard from Ray J? He is likely referring to the ejection fraction, or EF. The ejection fraction is the percentage of blood pumped out of the heart with each contraction. And a normal ejection fraction is anywhere from 50 to 70%. So when you hear that low number, 25% from Ray J, yes, it is concerning because it means that if this is what he's talking about, that his heart is not pumping out enough blood, okay? He has a reduced ejection fraction. And with this, you can get a backup of blood, a backup of fluid in the body, which can lead to swelling in the feet, the ankles, the legs. It can lead to a backup of fluid in the lungs, which can make you short of breath. It can make you have a cough. You can have a fatigue to the point where doing simple tasks like walking to a mailbox can make you straight up out of breath. So having a reduced ejection fraction all the way down to 25% really is serious, and yes, it is concerning. However, let me tell you, I have had many patients over the years who have had ejection fractions of 25% and lower. I've watched them improve, okay, with proper management, proper medications, proper lifestyle adjustments. Yes, I've seen them improve. Even for my patients who don't improve their ejection fractions like really significantly, I've still seen them through modern medicine and technology actually have decent qualities of life. It varies. Again, congestive heart failure and having a low ejection fraction is very serious. I don't want to minimize it. However, it is not an immediate death sentence, okay? There are things that can be done if it's caught. Okay, let's talk about the big question, life expectancy. In 2019, there was a review and meta-analysis of 60 studies and 1.5 million patients, and I'll admit, the life expectancy numbers for heart failure really were not very encouraging. Based on this review, the 5-year life expectancy was 57%, and the 10-year life expectancy was only 35%. But before you go Googling these facts and just like getting totally freaked out, do remember that a lot of this data is based on patients from a long while ago, before we've had all of the advances that we've had now. Plus, I don't want you to get scared from these numbers. I want you to be proactive and to think of these numbers as more of a starting point and not a finish line. They don't take into account you as an individual, the lifestyle modifications that you are willing to make, the technologies that we have right now in this moment, okay? So instead of Googling numbers and then becoming gloom and doom, I want you to think of yourself as an individual and think of what you might do. For example, if your congestive heart failure is due to high blood pressure, jump out there and manage your pressure, exercise. If it's due to alcohol overuse or to substance use, and we've heard Ray J in his video share that he was drinking bottles of alcohol, that he was doing Addy and different substances. Make sure that you commit and that you're intentional about stopping that substance use, okay? That can make a huge difference. Also, don't be afraid to use integrative medicine. Yes, a lot of my patients love natural remedies, holistic remedies, and heck, so do I. I also recognize that there is a time and a place for modern medicine and technology. In fact, when it comes to congestive heart failure, depending on the level of your ejection fraction, there are certain medications that are indicated and that have been really proven to work quite well based on years of large randomized controlled trials. And depending on the level of your heart function, you may even be able to be helped by something like an implanted cardioverter device, okay? Maybe a pacemaker, maybe something to shock your heart if it is at a big risk for having an abnormal heart rhythm. And we even have heart transplants, like what Nene Leak's son, Brent, had to have. Yes, he had a heart transplant. So don't focus on the scary life expectancy numbers that you Google. Focus on being proactive and taking control of your own health. There are 4 stages of heart failure. Stage A is when you are at risk. You might have a family history of someone with heart failure, or you might have high-risk conditions like high blood pressure, coronary artery disease, diabetes. Stage B is when you have no symptoms of heart failure, but you have some structural damage to the heart. Stage C is where most of my patients tend to get diagnosed. And this is when you actually start having signs and symptoms of heart failure, like the shortness of breath, the fatigue, the swollen feet and ankles. Honestly, you can live for years in stage C with the proper management and with a pretty decent quality of life. Of course, it's going to vary from person to person. Stage D is the severe stage. This is when you have end-stage heart failure and you have symptoms of heart failure even at rest. At this point, if your doctors have exhausted all medical management and procedures, they might consider giving you an LVAD or a left ventricular assist device. Stage D may be the point where your doctor starts talking about getting on the heart transplant list. The key is early detection, because the earlier that your congestive heart failure is detected, the more likely your physician is able to help you to slow down progression to the next stage. So, what really affects how long someone can live with heart failure? I'll tell you, it's not just that one number. It's not just the ejection fraction. It's really the whole picture. It depends on your medications. Are you taking the medications that your doctor has prescribed, and are you taking them properly? It depends on your lifestyle modifications. Have you cut back on the salt that's in your diet? Have you stopped using the alcohol? Have you stopped using the substances like drugs, like addies as they call them, like cocaine? Are you doing exercise? Are you keeping up with your doctor's appointments? Okay, all of this matters. It's also very important that you manage your other health conditions, such as diabetes, or if you're living with obesity. All of these things play important roles when it comes to your life expectancy, okay? Not just the one number. If you have heart failure, it might help to know that you are definitely not alone. We talked about Ray J, but what about the hip hop legend, Christopher Reed from the rap group Kid and Play? He shared that he had severe heart failure, and now he just had a heart transplant, and he's living his best life. And then there's President Bill Clinton, former First Lady Barbara Bush, and even the late, great Natalie Cole. These public figures lived for years with heart failure. And it just goes to show that having a diagnosis of heart failure doesn't mean it's the end of your journey. It means it's the beginning of one. Let's talk about the signs and symptoms of heart failure. And remember, signs are what you see, symptoms are what you feel. So some signs may include swollen feet, ankles, and legs, weight gain that you see on the scale. Another very rare sign that a viewer asked me about is clubbing of the fingers and toes. Again, this is exceedingly rare when we're talking about heart failure, but let's talk about it. So when you talk about clubbing, you're talking about a wide appearance of the tips of your fingers or toes. Okay, so they look, instead of like nice and smooth, they're kind of wide on the ends like clubs. And this is a sign of chronic severe low oxygen or chronic hypoxia. Now, we see this typically with severe chronic lung disease or even severe chronic heart disease, which of course, if you're someone who is in stage D of heart failure, then yes, you really could have chronic hypoxia or low oxygen, and it could lead to clubbing of the fingers or even toes. But again, this is a rare sign, but it's definitely something you would see. When it comes to symptoms of heart failure, symptoms may include feeling like exceedingly tired or fatigued, feeling like you're short of breath, feeling full early or having early satiety. And this happens if you have a backup of fluid that involves the stomach. And I don't mean the stomach like your belly. I mean the actual organ, the stomach. If you have swelling all over your body, like in your legs and in your abdomen, then very likely you also have swelling like in your intestines, your esophagus, and your stomach. And if you have swelling in your stomach, then that can make you full faster, okay? You get early satiety. So a full feeling early could be another symptom of heart failure. And a viewer asked me in the comments about chest pains. Can you get chest pressure or chest pains consistent with heart failure? And yes, that is a complaint of some patients. Another symptom can be feeling short of breath when you are lying down flat, okay? If you try to sleep when you're flat, you might just wake up like coughing and short of breath. And so that's why a lot of people with heart failure have to sleep propped up on several pillows or even sitting up in a chair. Here are some causes of heart failure. The most common one that I see in my practice is high blood pressure, okay? Years of uncontrolled high blood pressure that cause that heart muscle to have to pump against the high pressure. That can definitely lead to congestive heart failure. And then there's coronary artery disease, or if you have blocked heart arteries. If you've had damage to the heart muscle from a previous heart attack, that can cause congestive heart failure. Also, in some cases, viral infections, even certain chemotherapies like Azithromycin, that's one that's often used to treat breast cancer. If you have heart valve issues, that can be a cause. Diabetes certainly will put you at risk. We know that excessive alcohol and substance use can do it as well. The good news about heart failure is that we actually do have many effective treatments. We have medications that can help your heart beat better, that can help to relax the blood vessels around your heart. We have medications that can help you to get rid of excess fluid, okay, that backup of fluid. And we have different procedures. We have pacemakers if it's indicated. We even have defibrillators that we can implant, okay? And if your heart failure is really advanced, we even have ventricular assist devices and heart transplants. Here's the thing. The real foundation to any treatment is you and your willingness to put in the work, okay? Your willingness to go to your appointments on time, having conversations with your doctor, and really being compliant. And if you have questions, you can push back, but you want to make sure that you have shared decision making and that you respect and trust the doctor whom you are seeing. Are you willing to put in the work? Are you doing the exercise? Have you cut back on the salt? Have you quit drinking all the alcohol? So let me ask you this. What is one small heart-healthy change you are willing to make this week? Drop it in the comments below. Your idea might be exactly what someone else needs to get started. All right, let's bring it on home. Heart failure is definitely a serious condition, okay? There's no question about that, but it is manageable, okay? That's the point. I have many patients with heart failure who still live full and happy lives, and many of them live lives that are much longer than what the life expectancy numbers predict. You are not a statistic. Your life is not a number, and you do have a say in your journey.